Rynell Nolan, President, CEO, Health Agents for America, coming to you live today, this Monday. Opportunity, it's up to you. With the new administration, things are changing, laws are being signed, the way that we operate is changing. And it's up to you whether you accept this as an opportunity or you decide that you're defeated. I'm going to ask that you accept this as an opportunity. For those that work in the group market, especially the small group market, you definitely want to pay attention to the changes. If you're not working in the individual market, now is the time to get involved and to sign up and make sure that you take this opportunity at full value, that you make sure you've done the training, that you operate within the federal or the state exchanges. Everyone who is in the individual market is eligible for a tax credit, even those above 400% of poverty. So at least for the next 2 years, you're going to see the individual cost go down tremendously. So some of your employer groups, your smaller groups, might look into the fact that having individual plans might be cheaper for their employees because they get the huge tax credits, depending on the income levels. What I'm going to tell you is what I tell you and have told you from the beginning. If you are not educating your employer clients about these changes, or you are not educating your individual clients about these changes, someone else is. Someone's going to come in and say, did you know about the American Rescue Plan Act? And do you know that you could be getting tax credits? Do not let someone else take your clients. Make sure that you take care of your clients. A couple of things that I wanted to just shout out is the summit, August 26th, 27th. You're going to see in the Monday news and any publications about the summit, there is going to be a phone number to call and make your reservations. I encourage you to do that. Space is limited. And if you go to the Nodaway website, you'll be able to pick your rooms. There's different rooms in the mansion. There's some cottages, there's some suites, there's different options, but of course the rooms are limited. Our summit is small, boutique, so make sure that you definitely sign up for that. Tomorrow at 1 o'clock on the 30th, we are going to have a deep dive into the American Rescue Act by Angie Sura. Please make sure that you register. Also on the 31st is an opportunity for you to invite your clients. So that was sent out on Friday. Make sure to send that link to your clients, get them to sign up. It'll be similar programs, but the 31st will be directed to clients, and the 30th will be directed to agents and brokers. You do not want to miss that. Also, a huge shout out to Holly Hale, our legislative liaison in Florida. Every month or so, Holly sends me PAC dollars. She gets it. She understands it. She doesn't have a gigantic operation, but she knows that in order to survive, that I need PAC dollars. I need to get in front of the right people. We need to support those legislators that support us. And just thank you, Holly. Thank you from the bottom of my heart. You get it. And those out there that haven't given to the PAC, please consider. It doesn't have to be a lot. It can be anything, but it definitely helps with our survival. So a couple of other HAFA heroes that I wanted to talk to you about. Recently, Dean Cameron went before Congress to testify about the positive influence that agents and brokers have. He is the director of the Idaho Department of Insurance. If you have a minute, find his LinkedIn page, reach out to him, tell him thank you. We fully appreciate those that come out and give their support about the agent and broker community. He also talked about the positive influence of short-term plans. Of course, we should be showing our clients whatever their options are. In some cases, short-term medical is best. Some in a marketplace plan is best. Some private insurance is best. Some group insurance is best. And in some cases, a Christian ministry plan could be what is best. So those things are important to make sure that you're doing your due diligence and showing everybody all the different plans that they could have. The other thing is they talked about the Navigator program and the fact that the Navigator program was responsible for 1% of the 1% of the signups, which is ridiculous, and they cost the government. The government and American people money. Other HAFA heroes: Billy Long, Representative Billy Long of Missouri, and Representative Buddy Carter from Georgia. They also argued that supporting agents and brokers would be better value than increasing subsidies. So reach out to Billy Long, Missouri, Buddy Carter, Georgia. I don't care if you're from those states or not. They are testifying in Congress about us, and they support us. So thank them for being a hero, and please reach out to Dean Cameron and thank him for being a HAFA hero, being an agent and broker hero. Let's see. There are a couple of bills that are on the federal level that you need to know about. HR 1874 would provide another $100 million for new funding for healthcare.gov navigators. Now, we know that navigators are not effective. We know that it costs more than agents and brokers to enroll. We know they're not effective, but the government is considering giving them more money. We will definitely want to let our representatives, our legislators know HR 1874 is ridiculous. The other is HR 1796 that would give $200 million more in state health coverage enrollment tech funding. So those that have state health exchanges, more money for them. So let's see. Of course, there's always somebody on the other side, and you need to know about that. Representative issue from California, of course, is well, she's really not saying anything about agents and brokers. She's more talking about Medicaid expansion. So she's just trying to get some Medicaid expansion, Democrat, from California. There was a lot of talk about short-term medical, so definitely pay attention to that. The IRS says face masks and hand sanitizers are tax deductible. That's something that you might want to let your clients know. Hospitals are using computer coding to skirt the transparency rules, according to the Wall Street Journal. Of course, we knew that was going to happen. Anytime you call for transparency, there are going to be folks out there that do not want to do that. Another important thing, and I hope you've been paying attention to this, you know that you're in the middle of a special enrollment period that President Biden signed into law. He has now extended that to August 15th. So that means that you can enroll people for any reason whatsoever, change their plan into August. So April 1st, in a couple of days, that switch is going to flip, giving people more tax credits. Also, you'll be able to do this until August. So if somebody wants to change their plan, they want to join, they want to get coverage, they haven't got coverage in the past, you definitely want to pay attention. Remember, if you enroll someone August 20th, it goes into effect May 1st. If you enroll somebody April 30th, it goes into effect May 1st, the first of the month following. Now, all changes for the tax credits will be done after April 1st and go into effect May 1st. So the tax credits do go back to January. So they will get credit on their tax returns for tax credits back to January, but we can enroll them going forward April 1st. They'll get the actual tax credit May 1st going forward. Now, if someone says for some reason they do not want to adjust their accounts right now, they don't want to take the tax credit right now, they will, of course, get it when they file their taxes. And again, Angie's going to do a really deep dive into the American Rescue Plan Act. You must know about it. And the Benefits Pro has an article in this Money News, and individual plans are going to be cheaper than group. And that's what I said in the beginning. This is something that you need to pay attention to. You do not want an agent to swoop in and to take all your group clients, because they're showing them a way to save money and their employees to save money. So there's that article is good by Benefits Pro. Hold on, let me get to the next. There is a CMS article about the opportunities to enroll through the Affordable Care Act, so you want to go ahead and read that. So that's a CMS article that's in the Monday Morning News. And I did participate in a call with the new Secretary of HHS, Mr. Javier Becerra, and it was interesting, the different groups that called in and talked to him, and we want to make sure that and I will reach out to him to see if there's a way that I can meet with him to introduce us, to let them know, you know, who we are and that we're part of the solution and not the problem. One thing that I wanted to talk about that I found very interesting, and this was health insurance robocallers face a record $225 million fine by the FCC. So it was two Texas-based telemarketers reaching out, trying to get people to buy short-term medical, and being fined. So you want to pay attention. If you have a call center, or you're thinking about having a call center, make sure that you pay attention to exactly what's going on. There's also a analysis on the Biden's healthcare plan, how we got here, what they think it's going to look like. Also very interesting, I thought, of course, and you'll understand why I prefaced that with workers want a pet-friendly post-pandemic office. So more folks are bringing their dogs to work, and of course, Faith is always under my desk, and when the HAFA office finally gets up and running, she'll be going to the office with me, so it will definitely be pet friendly. I did get a email from our contractor this morning asking us to turn the water on, so I'm assuming that he's moving right along. We're almost at the 2-year mark, but we're moving along. The Think Advisor has an article about the new federal surprise medical bill law might be tricky to implement, so take a look at that one. And another Benefits Pro about what's new to know about Biden Care. And I believe that's all that we have for this Monday. Remember that to register for the event tomorrow, American Rescue Plan Act. Also, the 31st, Wednesday, for your clients to participate, and they can learn about COBRA, tax credits, things like that that they need to know. I was on a call this morning that was talking about the COBRA section part that we've been talking about. After they get that free, you know, after the free coverage is over, what happens? Does the cost go back to full cost? And they were saying they're waiting for guidance on whether that would be an SEP. So that'd be something that we would find out in September, but you will learn a lot tomorrow. Your clients will learn a lot on Wednesday. It will be recorded. If you do not get an opportunity to listen, that we will be providing that link for you to watch at a later date. A little update on Louisiana session. I have been meeting with several legislators and giving what PAC check money that we have out. And I have not seen the bill filed yet for the state exchange by the Department of Insurance. And again, HAFA has been talking to legislators about turning this into a study resolution because of the American Rescue Plan Act and all the changes and tax credits there. The fact that this really needs to be studied. Agents and brokers want to make sure we're at the table. And this is something that is actually going to save dollars, and it's not going to change someone's plan, and it's not going to put a burden on the industry. So absolutely something that I've been working really hard on. The other coming out of Louisiana is the authority to file for a 1332 waiver. HAFA will not be getting involved in this bill at this time. Basically, it says that Louisiana would file for a 1332 waiver. Everyone who has a plan, including employer groups, including ERISA groups, would pay into a fund that would in turn bring the cost of insurance down. Because of the American Rescue Plan Act and the fact that the cost to consumers is going to be coming down tremendously, the thought of all the employer plans paying into a plan that we may not need at this time is just not something that HAFA feels very supportive about. And then the third thing that we're also not getting involved in is that Commissioner, and the 1332 waiver is a Commissioner Donlin bill, Department of Insurance, and also the emergency bill that would give him the authority to make emergency rules should there be a hurricane or a flood or whatever. And that is something that the PNC associations are getting really involved in, but that is something that HAFA is just kind of watch and see. So basically, we're really busy. I'm running around like crazy, the usual, trying to get prepared for the legislative session. I need PAC dollars. I need to, especially in Louisiana, to replenish that money that I've had to give out to those key folks on House and Senate and Speaker of the House and all those people that help and protect our industry. But I'm here if you need me. Have a wonderful, wonderful week. Look forward to seeing you on the call tomorrow. Please email me, call me, text me if I can help in any way. Ronell Nolan, proud and honored to represent the HAFA Freedom Fighters, the cream of the crop, the best of the best. Love you all.